Hi, my name is Joseph from Mental Health Europe, and today we're going to be discussing psychiatric medications. You might be here because your doctor has prescribed you medication, or you're thinking about asking for it. Psychiatric medication can affect our mind, emotions, and behavior. It can also alter the way we feel and think. Some may find it beneficial, describing a sense of temporary calm. On the other hand, many report unpleasant experiences, especially if our body becomes dependent on the medication. It's best to see psychiatric medication as a tool to supplement other forms of therapy. You may be wondering what types of psychiatric medications exist. Here are a few you might have heard of. Antidepressants. Antidepressants are the most commonly type of psychiatric medication prescribed. As you can imagine, they are usually prescribed for people experiencing depression. However, as their use continues to increase and diversify, it's possible your prescribing doctor may give them to you for a number of other reasons. The most common type of antidepressant, what is called an SSRI, but other types exist as well. Benzodiazepines and related drugs. A class of drugs discovered in the 1960s and known as minor tranquilizers are often prescribed for anxiety or insomnia. As of the late 1980s, new drugs were introduced known as the Z drugs. These were chemically different from benzos, but have a similar effect. Antipsychotics. As you may be aware, antipsychotic medication is usually prescribed to people experiencing psychosis or schizophrenia. They're usually used to treat acute episodes of psychosis, but are also used in other situations, such as to calm or subdue people deemed agitated or aggressive. Lithium and other drugs referred to as mood stabilizers. When we talk about mood stabilizers, we're usually talking about drugs that are prescribed to people experiencing what is known as bipolar disorder, which some people used to call manic depression. Stimulants. Stimulants are simply drugs that do exactly as the name suggests: stimulate. They are a controlled substance, but are often used recreationally. Think cocaine or amphetamines. However, they can also be prescribed commonly for ADHD. So how do these drugs work? The idea behind the development and use of these drugs was seemingly quite simple. Mental health problems are supposedly caused by flaws or imbalances in your brain chemistry. And to address this, we need to flood your brain with the chemicals found in psychiatric medication in order to change your brain chemistry back to its original state. The problem with this? The research simply doesn't back this idea up. Years of research has failed to consistently show that biological malfunctioning, such as abnormalities or other markers, can reliably predict or identify mental health issues. Does this mean that psychiatric drugs don't work? Not necessarily. Psychiatric drugs can be beneficial for certain people, but may not work for others. The scientific community is just not certain how it is exactly that most of these operate. If you find yourself having been prescribed psychiatric drugs for the first time and are unsure what to do now, the first thing would be to find someone you trust. This might be a friend or relative, to support you in finding the right information for your case. The questions you might ask your doctor depend on what's important to you, but often people might ask the following questions: what sort of side effects you could experience and how long these could last? What positive effects could be seen in your case? What negative or unpleasant experiences you are likely to have? What the risks to your health and overall functioning might be, how long you should expect to be on these drugs for, what can you do if you find that the effects of the drug are either unhelpful or worse than how you felt before. If, for whatever reason, you decide it's no longer for you, how can you go about stopping these drugs? You might be able to find answers to some of these questions online, but be wary of the reliability of the source, as there is a lot of misinformation out there. You can find some links to reliable information in the description below. Consider online research as an extra, not a replacement for the discussion you have with your prescribing doctor. If for whatever reason you feel that you cannot have this conversation openly and honestly with your doctor, it might be time to think about finding a new one. Psychiatric drugs are often given to people over many years, sometimes over someone's entire lifetime. The reason often given for the prolonged use of the drugs is that a maintenance dose is used to prevent a relapse. Perhaps you are experiencing only the beneficial effects of the drug and they are not impacting your daily life negatively. Like everyone who's been taking medications for a while, you might still have questions about long-term effects. These questions can be tricky because when the drugs are new or funding is short, long-term studies on effects effects can't be run. Still, people might sometimes ask about the following: our body becoming habituated to the drug and it becoming less effective, normal daily life becoming difficult due to your mental state. Sometimes people describe feeling emotionally blunt or flat, or being unable to concentrate or settle down to a task. Physical changes that are impacting how you live, such as shaking, pain, weight loss or gain, loss of energy, nausea, or sexual dysfunction. If you are worried about any of these, you can ask for a review of your medication. It is very important that if you are thinking of stopping medication, you discuss how to do so safely with your prescribing doctor. Most drugs create a dependency on their use. Therefore, immediately halting the medication can cause further problems or cause the initial experiences for which you were prescribed the medication to come back worse. Your doctor can guide you through discontinuing the drug in a gradual and safe way if that is the right choice for you. Ultimately, the decision as to whether or not to continue using psychiatric drugs is up to the person taking them. You. If, having weighed up all the pros and cons, you decide to reduce or stop your prescription, it's important to recognize that this could be a difficult process. If your relationship with your prescribing doctor is good, they can help you in exploring and researching withdrawal together. It may also be necessary to reassure friends and family that your decision is being made in full knowledge of effects and consequences. Stopping a form of treatment that they believe to be crucial to your well-being could be worrying to them. The specific advice you need is as unique as you are. Just as your physical health and individual response to any drug can vary from someone else's, so will your response to the withdrawal from the drug. So remember, whether you've been prescribed medication, or looking into starting, or are thinking about stopping, do so safely and armed with all the information you need to make the right choice. At the end of the day, the choice is always yours. If you or someone you know may need more information, you can visit our website to discover our short guides and other useful resources. If you're interested in more videos on mental health, or are interested in the work that Mental Health Europe does, follow our channel to stay updated.